Welcome to Perioperative Services Malignant Hyperthermia MH Update. The procedure was updated in May of 2017 and combined with MH policy in December of 2017. A few changes include delineation of roles. In addition to anesthesia provider, lead runner, medication lead, and patient cooling lead roles, we added anesthesia equipment lead role. Reorganization of emergency MH cart contents, and the daily and monthly check and dosage mixing chart are attached to the policy appendix. The role of anesthesia equipment lead supports anesthesia provider to discontinue triggering agents such as sevoflurane, isoflurane, or desflurane, insert charcoal filters, and flush breathing circuit with fresh oxygen. Job action sheets for anesthesia provider and lead runner remain the same. There is no change to patient cooling lead and medication lead roles. Let's take a look inside the MH cart. Drawer 1. Blood culture kits are no longer stocked. Red pull tie seals have been added for convenience of locking the cart. Drawer 2. Spike tubing set, lubricating jelly, and tubing clamp are added for bladder irrigation purpose. Cold saline infuses into bladder through urinary catheter and cools the body. The photos explain how an irrigation tubing fits the urinary catheter via Loro-lock connection. A tubing clamp is used to keep the cold saline inside the bladder. Be mindful not to overextend the bladder. Drawer 3 contains supplies for arterial line insertion and blood transfusion. The all-in-one arterial catheterization kit is a new addition to the drawer, replacing multiple loose pieces. Drawer 4 is the pharmacy drug module, which is checked monthly by pharmacy tech. Every MH cart contains 36 vials of dantrolene sodium. Drawer 5. Sharps hypo needles have been replaced with mini spike dispensing pins for mixing and withdrawing medication. The quantity of 1 ml, 5 ml, and 10 ml syringes have been reduced to 5 each. 3 stopcocks are added. Drawer 6 contains the new temperature Foley tray and a gray cable for connecting to anesthesia machine. Pediatric supplies have been updated to meet the needs of areas that care for infant, children, and adolescents. MH daily and monthly cart check forms are attached to the policy and can be printed from the intranet as needed. Here are some added features to the monthly check. Monthly cart check is not required after pharmacy monthly inspection. Pharmacy note is on the bottom of the page. Supplies ordering information in the far right column, and for areas without anesthesia support service, option of storing charcoal filters in drawer 6. Dantrolene dosage mixing charts are kept in the MH binder and available on the Internet from the policy page. Mix vials with 60 mL of sterile preservative-free water and shake them until the solution is clear. Remember to flush with 3 mL of sterile water before and after dantrolene administration. The MH policy can be accessed on the Intranet under Resources, Perioperative/Interventional Services, and a paper copy is kept in the MH binder. Let's take a look at the policy. It begins with the policy purpose and malignant hyperthermia definition. The causative agents and signs of MH are listed. Here is the definition for rebound phenomenon. Under equipment and supplies, pharmacy helps stock and inventory medications for MH treatment. The patient education packet is ordered from a website called mhouse.org. mHouse stands for Malignant Hyperthermia Association of the United States. The medication expiration date label is posted on the front of the medication drawer. The charcoal filter absorbs trace amount of anesthesia gas so that it does not reach the patient. Charcoal filters are stocked in the anesthesia workroom. As mentioned earlier, for areas without anesthesia services, charcoal filters can be stocked in drawer 6 of the MH cart. During an unanticipated MH event, the surgeon is immediately notified and will halt the procedure as soon as possible. While the anesthetic gas is discontinued and charcoal filters installed, the circle breathing system and CO2 absorbent need not be changed. Hyperkalemia, or a high potassium level in the blood, can cause serious arrhythmias. Insulin stimulates the uptake of potassium in all cells of the body. Pharmacy has designated 1 vial of insulin R for MH use only and stores it in the Pyxis refrigerator or a locked medication refrigerator. This page describes the role of a primary nurse who uses the code button to call for help in an MH crisis. If the situation escalates to code blue, the nurse will immediately get the code blue cart and document on the CPR record. The primary nurse also distributes the job action sheets and organizes tasks, including mixing dantrolene, the only drug that is known to reverse MH. Following an MH event, the patient is transferred to the ICU. Send extra pre-mixed dantrolene vials too. They should be protected from light and are good for 6 hours after reconstitution. Also remember to send patient education packet with the chart so the family and patient can take it home by the time of hospital discharge. The daily and monthly cart check, as well as dantrolene dosage mixing references, are part of the online policy and procedure. They can be printed as needed. A poster for emergency therapy for MH is available on top of the MH cart. notice the MH hotline number. An expert on the phone can walk you through the steps during the MH crisis. Another resource is the MH Binder, which comes with a copy of the MH policy and procedure, job action sheets, dantrolene dosage mixing chart and mixing diagram, daily monthly check forms, downtime lab forms, CPR forms, and MHouse patient education kit. Let's review. MH crisis can be fatal. Prevention and early detection is key. When MH is suspected, stop anesthesia gas, call for help, get MH cart, give dantrolene, and start treating symptoms as appropriate. Preventing MH crisis requires a collaborative effort. In the pre-procedure setting, ask patient about past reactions or problems with anesthesia. If a patient is susceptible, bring MH cart into the procedure room and avoid triggering agents by removing any trace anesthesia gas, installing charcoal filters, and flushing anesthesia machine with oxygen. Actively manage the MH crisis by doing your part of the job. Everyone has an important role. Don't forget to confirm a task and report back when it is complete. Know the resources in your work area. You can look up the policy online, know what's in the MH binder, and read emergency manuals in the OR and treatment areas. The website mhouse.org has a lot of information for professionals and the general public. Can you locate the MH cart, insulin, ice, cold saline bottles, and cold saline IV bags in your work area? Knowledge check question 1. Name a few changes to the recent MH policy. Knowledge check question number 2. Name a few changes to the MH cart. Knowledge check question 3. MH job action sheets include these roles. Thank you for reviewing the updates of malignant hyperthermia procedure with us. Please let the PeriOp education team know if you have additional questions. Goodbye.